Good afternoon, everyone. Last year at Impact Health, MaRS and the Canadian Cancer Society launched the Rural and Remote Community Cancer Screening Challenge. This is really a full circle moment for us. We started with a simple but urgent reality. People living in rural and remote communities in Canada continue to experience later stage diagnoses and poorer survival rates. This challenge was designed to address that gap. We weren't just looking for good ideas, we were looking for solutions that understood the complexity of these communities and could navigate barriers like geography, socioeconomic constraints, trust, and access. Most importantly, we intentionally focused on a strengths-based model. So a strengths-based approach to solution building, recognizing the deep well of knowledge that exists in rural and remote communities. Over the course of this challenge, we saw exactly that, and probably a whole lot more, with solutions coming in from 8 provinces and territories, the most diverse geographic range of any of our MaRS challenges. Selecting a winner through this pool of outstanding solutions was incredibly difficult, but one solution stood out for its ability to combine strong implementation with clear impact, and a model that leads to direct screening outcomes. And so it's my immense pleasure to announce that the grand prize winner of the Rural and Remote Community Cancer Screening Challenge is Gateway CERH of Excellence in Rural Health in Goderich, Ontario. This team has demonstrated not only what's possible, but what it looks like to translate innovation into tangible change on the ground. To continue the conversation, I'm excited to welcome to the stage Gwen Devereaux, President of Gateway CERH, as well as Aaron Bussin, my partner in crime, Director of the Centre for Cancer Prevention and Support at the Canadian Cancer Society. As they take their seats, I just want to thank our judges, our advisory council, all the applicants from across the country, and all of our challenge finalists, Oncology Simplified, Praxis Health, Virtual Health Hub, and My Breast Day. Finally, I just want to take a moment to thank the Canadian Cancer Society for their incredible partnership in this work and for translating aspiration and vision into tangible impact for the lives of millions of Canadians. And with that, I will turn it over to Aaron and Gwen. Thank you.
Thank you, Shilpa. Congratulations, Gwen.
Thank you.
Can you tell us a bit about Gateway Centre of Excellence in Rural Health and the community you serve?
Well, thank you, Shilpa, and thank you, Aaron. First of all, we are very thrilled to have received this award, and we can't thank the MaRS Association for developing the challenge and for the Canadian Cancer Society for awarding us this. It means a lot to us. And so you want to hear about Gateway now?
Yeah, tell everyone about Gateway.
Yes. So Gateway Centre of Excellence in Rural Health is a not-for-profit charity located in Goderich, Ontario, on the beautiful sandy shoreline of Lake Huron. And we are a community-driven not-for-profit. And our mission is really just to keep our rural residents healthy through our research, our communication, and our education. And we look at the rural health issues in Grey, Bruce, Huron, and Perth counties, which have a population of about 300,000 and are extremely rural. So I think that, to our knowledge, we are the only standalone community-driven rural health research center that has a number of academic partners and healthcare partners that we work with. And we are definitely based in volunteerism. We have 17 research chairs that are all volunteers from various academic and healthcare sector, and we have an extremely hardworking board of directors that have varied business and healthcare backgrounds as well.
Can you tell everyone what motivated you to apply to this challenge?
Well, the issues in rural are probably common knowledge to most of you. Most of you know that we have an extreme shortage of family physicians across rural. In 2 of our counties, here and in Perth, we have over 20,000 people who cannot find a family physician. And we have an older population, and traditionally our older population would look to their family physician for direction in cancer screening and treatment. We, coupled with that and the lack of limited awareness campaigns, we have a higher rate of obesity. We have higher usage of tobacco and alcohol. And again, with the older population, these are all risk factors for increased incident. So we felt Gateway had the ability to have the reach to get to these people.
Sounds like Gateway is the gateway to preventative care when you don't have healthcare providers. So can you tell everyone about your winning solution and what you achieved in the implementation phase?
Well, we have had a multifaceted approach, reaching out to local organizations in fire halls, in senior centers, in familiar locations where people would locate. And we used 4 social media platforms and reached over 7,000 people. And just building on our farmers' shed talks and our seniors events and so on, we reached about 500 residents in providing packages for them to understand screening. And so our volunteer firefighter project, where we're already screening for blood sugars, blood pressure, PTSD, we just layered in that information on cancer screening. Our senior, at our Legion, we provide support to our seniors for tech support. So we layered in presentations and information on cancer screening. And at our farmers' shed talks, where our farmers gather to talk about health and safety, we layered in our screening. So on top of that, we attended several health fairs and symposiums that were happening in the region.
It seems like you really know your community well and meeting people where they're at and doing programs that already exist. But what do you think made your solution so successful?
I think we're a trusted organization. I think we do know our demographics and our understand and appreciate their hesitations and concerns. And we have tough rural residents. Our farmers, they don't take sick days. They will only seek medical attention if needed. I'm generalizing. We have our volunteer firefighters, young, invincible men who aren't necessarily going to seek out their annual medical if they do have a family physician. And our seniors, creating that relationship with them and building awareness was key. And I think I just want to mention one particular woman that was in a senior residence where we were doing a health fair. She had shared with us that she lost her husband with cancer. And she said, what was really impactful and resonated was she said, I wished I would have known more. I wished I would have pushed harder. And she picked up several of our packages to take to her family and friends. So I think that one-on-one relationship that we built made them comfortable to share.
So today, we just announced that Gateway Center of Excellence in Rural Health is the grand prize winner of $100,000 in funding to grow your innovative program. What is next for your organization?
Well, first of all, we're going to pull our team together. And our strategy is between our nurse practitioners and our pharmacists, we've created a partnership. And we'll get the most relevant, updated information more broadly out there by creating this partnership, and then aligning also the programs that we are going to continue doing that we are doing now, no difference. And one thing that we're doing very soon is we're participating in a fashion show where there are 22 models that are all cancer survivors, and they're going to share their story about early screening, early intervention, and the difference it made in their lives.
So for my last question, what do you think the innovation community can learn from your team and this innovation challenge?
Well, I think it's a grassroots movement, neighbor to neighbor, friend to friend. I think meeting the people where they are at and that non-clinical setting, I think is really important. Familiar community faces, and I think approaching with positivity is so important. I think all everyone is hearing is this increased rate of cancer. And instead of looking upon that negatively, I think our message needs to be, isn't that incredible that we have the technology, we have the ability to screen early and treat early and save people's lives.
Thank you so much, and congratulations again. We're so proud, and we can't wait to hear about your ongoing success.
Thank you.